At this meeting of defense ministers, we will take decisions on our preparations for a possible second wave of COVID-19, updating national resilience guidelines, deterrence and defense, including our response to Russia's new nuclear-capable missiles, and NATO missions and operations, particularly in Afghanistan and Iraq. Sorry. Since the beginning of the COVID-19 pandemic, NATO and allied armed forces have played a key role in supporting civilian efforts, with some 350 flights airlifting hundreds of tons of critical supplies around the world, almost 100 field hospitals, and more than 500,000 of troops have supported the civilian response. All of this has helped to save lives. Now, NATO is preparing for any future health crisis. I expect ministers will agree on three things: a new operation plan to be ready for any second wave of COVID-19, a stockpile of medical equipment to provide immediate assistance to allies and partner countries, and a fund to acquire critical medical supplies. These three elements together will ensure that we can strengthen our response to a possible second wave of the pandemic, so that critical assistance gets to the right place at the right time. But COVID-19 does not mean that other challenges have gone away. Ministers will also discuss the NATO requirements for national resilience. These cover critical sectors such as energy, transport and telecommunications. Any vulnerability in these areas can be exploited by potential adversaries. I expect ministers will agree updated baseline requirements for resilience.